No Mainer should have to worry about taking on more debt to protect themselves from the virus. And under this bill, health insurance companies would be required to cover COVID-19 testing and screening in Maine and eliminate the co-pays for these services after the state of emergency has ended. The same is true for COVID-19 vaccine. After almost a year of battling this pandemic, there's a light at the end of the tunnel for the vaccine. However, these life-saving immunizations will only be life-saving if people can access them. The COVID-19 Patient Bill of Rights will eliminate barriers and ensure that the health insurance companies can't stand in the way of protecting Mainers. Where you live and how much money you have should never make a difference in determining whether or not you can get the care that you need, especially as our nation grapples with a deadly pandemic. Healthcare is a human right, and it's essential living your life freely. However, affordable healthcare remains out of reach for far too many people. It goes against our values, and it stands in the way of getting our state and our country safely on the road to recovery. It would make sure that Mainers across the state have access to care during this pandemic without risking their health to go to a doctor's office or make frequent trips to the pharmacy. This is especially important for seniors and Mainers with chronic conditions who face health greater risks during this pandemic. There's no question that COVID-19 is going to dominate our work here in the legislature this year. You know, we've introduced the COVID-19 Patients' Bill of Rights as the very first order of business because it underscores the goals of the legislature to put patients first and prioritize the health and security of Maine people and businesses over mega corporations in this recovery. It's also the first step to healing our state and getting our economy back on track. All across this state, Mainers are reeling from the COVID-19 pandemic. It has threatened the health and safety of Mainers, disrupted our economy, and destabilized our working families' financial stability. As of this weekend, COVID-19 has claimed the lives of 432 Mainers, including 22 people from Rustic County. Some of these people I knew my entire life. Each loss feels tremendous. We've mourned parents, grandparents, teachers, coaches, veterans, and beloved members of our community. And it's been really difficult. Hard to imagine what families are going through. To me, this bill is very personal. It's about doing everything we can to protect Mainers and put an end to the loss and destruction. The only way to move forward and successfully rebuild our state is to make sure that Mainers can get what they need to stay healthy, recover from this virus, and get the best protection available going forward. The COVID-19 Patient Bill of Rights brings us closer to a world where grandparents are able to safely play with their grandkids and hug their own children. It brings us closer to a world where Mainers can lose their voice at concerts, meaning that they're yelling and having a good time with others. Watch the Super Bowl, which is coming up, maybe even the college title game tonight, and can celebrate with friends, birthdays and weddings. Everyday things that we used to find so normal that we've lost for such a long time now. The COVID-19 Patient Bill of Rights brings us closer to the end of this crisis and the hold that COVID-19 has had over our lives. So with that, I want to pass it to Speaker Fecteau.
Thank you. Welcome to all of you, and thanks for joining us today. Senate President Jackson, thank you for your remarks and your passion on on this particular issue, on issues surrounding healthcare that you have been a long-time champion of. For those of you who don't know me, I'm Ryan Fecteau. I have the pleasure of serving as Speaker of the House, and I'm proud to also represent my hometown of Biddeford here in the state legislature. I've been in this role for just about a month now, and while it isn't exactly as I imagined it would be when I first decided to run for this position over a year ago, however, what is the same as I imagine is the honor and the enormous privilege I feel to hold this role. For me, you see, my meme and Pepe moved, and my dad moved from a rural farmhouse in Quebec in 1964 to Biddeford in order to work in the textile mills. My grandparents spoke very little English. They had very few means, but they had the determination to build a better, more prosperous life for their family. By no means was it always easy. My parents divorced when I was young. My dad worked in the dye house at the textile mills for many years. My mom, who had dropped out of high school in 10th grade, raised me and my sister in low-income housing, driving a beat-up, unreliable car, and depending on food stamps to put food on the table. And sometimes that wasn't even enough. For me, these are memories, but for too many Mainers, this is reality. And during this pandemic, countless families are facing hardships they never could have imagined a year ago. For many families, they're relying on services that they themselves never could have imagined having to rely on. That leads us to where we are today and why we're here. As I've come into this role, I've been asked about what our priorities are, and if we'll be able to accomplish them amidst the backdrop of a global pandemic. I hope today that it is clear that our priority will be our recovery from COVID-19, both for our people and our economy. And that, yes, we will accomplish them. It is simply too important to me personally and to our state not to. LD1, the COVID-19 Patients' Bill of Rights, is just step one. This bill is about making sure nothing prevents Mainers from getting the health care they need to protect themselves, their families, and loved ones from this serious virus. Under the COVID-19 Patients' Bill of Rights, all Maine health insurance plans would have to cover COVID-19 screening, testing, and immunizations, and waive all copays for these services. Healthcare professionals could prescribe patients with up to 180-day supply of most medications during a state of emergency. Patients can receive audio-only telehealth services. These common sense changes to Maine law are desperately needed given what we've already learned responding to COVID-19. We cannot have costs be a barrier to testing or to treatment. Also, the importance of requiring insurance companies to cover immunizations for COVID-19 is critical. Getting Mainers vaccinated is the best way to put an end to COVID-19's hold on our state, our lives, and our economy. While some of these things have been happening, we know that enshrining them in state law is absolutely vital. Just ask any person who has argued with their insurance company over a bill that they didn't expect. Throughout the next legislative session, we're going to be doing everything we can to move forward and successfully rebuild our state. I know we face tremendous challenges, but I also know that we can and we must work together to face them. For me, I'll be working to make sure Maine people can get what they need to stay healthy, recover from this virus, and get the best protection available going forward. And that's what this bill is about. The COVID-19 Patients' Bill of Rights is going to accomplish this and set us on the right path. Next up, we're going to hear from Dr. Hagopian about his experience in the past 10 months and how this legislation will assist in his practice. Dr. Ben, thank you so much for joining us today. And more importantly, thank you so much for the work that you and your colleagues across the state have been doing throughout this pandemic. I know for you and your colleagues, it has been perhaps the most challenging time of your careers, and we really appreciate all the work you're doing. We cannot thank you enough.
Thank you, Speaker Fecteau and Senator President Jackson. Thank you so much for having me here with you today. I'm Dr. Ben Hagopian, and I'm a family physician with a specialty in integrative medicine. For the past 10 years, I've provided primary and integrative healthcare in both rural and urban Maine. But the last 10 months has brought entirely new challenges to my patients, to my practice, and to the healthcare system overall. Personally, at the beginning of this pandemic, there were unpredicted challenges many of us in the healthcare system faced. I moved out of my home temporarily to keep my then pregnant wife and 3-year-old son safe. There was so much we didn't know about severity, about transmission, the impact on pregnancy, and I just didn't feel like I could put them at risk by staying at home while fighting back this virus. Fortunately, I'm happy to report that I now have a healthy, happy, and very smiley 3.5-month-old, and I'm doing my best to make up for that time I was out of the house away from my family. During this public health emergency, I have swabbed and treated numerous patients for COVID-19, and alongside the fevers and coughs and fatigue and just feeling run down and sick, I've seen the fear, anger, and financial frustration that comes with navigating a healthcare system that doesn't always seem to put health first. I think anything that can be done to remove barriers to testing, treatment, and protection of the public health is hugely important. When people are able to feel confident they won't rack up a huge bill for evaluations or tests, they can quarantine earlier and help prevent further spread of the coronavirus. I've also appreciated the increased access to telehealth. I've been treating many patients over the internet now, and I've even developed a good website manner. But there are many times that video isn't absolutely necessary and a phone consult will do, or a patient doesn't have a solid enough internet connection to do the video consult. So I feel it's important to make sure that all Mainers have access to care without making an unnecessary trip out of the house. There's a long road ahead of us when it comes to recovering from this pandemic. And just as my colleagues and I are committed to doing the hard daily grind frontline work that's necessary, I hope that all members of government are committed to doing their part. I'm grateful to be a part of today's event, and I thank Senate President Jackson and Speaker Fecteau for sponsoring this legislation. Thank you.
So with that, I'd like to open it up for questions from the press. If you have a question, please raise your hand or shoot me a message, and I'd be glad to unmute you. John, did you have a question? Looks like.
Can you hear?
Yes, we can hear you, Don.
All right. I have two questions. They're different. One, I guess, I thought the vaccines were free. So is that part of this really even necessary? And then the second question is, have you consulted with your Republican colleagues at all in introducing this? Is this going to be the start of a bipartisan approach, or did you not?
So, Don, thanks for the question. The issue with the vaccine is that we want to make sure that there's absolutely no barriers enshrining this in state law, so that Maine Care, state employees, teachers, the individual market that Maine is able to affect at all points, anything that the Maine Legislature can control as far as health insurance. We want to make sure that people know that vaccines are free and that there's no barrier for them to getting them. And that is absolutely a problem for people that aren't sure, can't afford to pay more out of pocket. And that's why we're making sure to put this in statute so that people know very well, and there's never any doubt that they can be tested for free and they can get the vaccine for free. In addition to that, we will definitely be reaching out to the members of the people on the committee, leadership on the Republican side, definitely hoping to have a bipartisan work on this and agreement. I see no reason why we wouldn't. And so that'll all be conversations that, I will certainly be having with my colleagues in the Senate, and I'm sure Speaker Fecteau will be doing the same.
Absolutely. Yeah, I think that this legislation is really important to setting the tone for the work that we'll be doing throughout the upcoming session to ensure, again, that Maine people have access to healthcare at no cost, especially when it comes to these really important elements to keeping our communities healthy and safe. Testing, vaccination, being able to see your doctor when you suspect that you possibly might have symptoms of the virus. I hope and I expect that my colleagues on the other side of the aisle will join us in supporting this bill and supporting other aspects of addressing COVID-19 as we head down through this session.
Don, does that answer your question?
That did, thank you.
So now we're going to move to Phil Hirschkorn at WMTW.
Thanks.
Oh.
Phil, are you there?
Yeah, I keep getting the, can you hear me? I keep getting the unmute signal. Can you hear me now? You can hear me now? Okay, great. You can hear me but not see me. That's just as well. Last March, the day we had our first case, I recall that Governor Mills, by executive order, ordered what sounds like the same thing. In other words, that screening and testing would be no charge. So my first question is, how does this proposal differ? Number two, to be clear, and I think Senator Jackson, you just made this clear, this really applies only to healthcare plans that are regulated by the state of Maine, correct? Not, for example, everybody's employer-provided plan would apply. And third, you talked about copays, both of you, but you didn't talk about deductibles. Very often, our health insurance plans don't pay for anything, including copays, unless you've already met your thousands of dollars a year deductible. How do you address that? Thank you.
Well, on the first aspect of your question, Phil, this bill is enshrining into statute many aspects of some of the executive orders that Governor Mills has initiated over the last 10 months. So yes, it is true that the governor has taken some action on some aspects of this bill through executive order. The intention here is to make sure that the initiatives that the governor's taken through executive order are enshrined in statute. That the legislature is saying that we agree with what has been the action that's been taking place through executive order, and that we want to make sure that Maine people know that these provisions will remain in place, and that the law commands that these provisions be in place. So I think that's really important. I think it's important for Maine people to know that these provisions are law and not just executive orders.
Yeah, I think Speaker Fecteau nailed it. And the executive orders are for testing. Making sure that everyone knows that vaccines are free is going to be critically important. I mean, at this point, obviously the governor's office and CDC has been working really hard to come up with the best strategy for having people vaccinated for the limited amount of doses that we've had at this point. But like, I constantly get calls from people that are either trying to find out when they can be vaccinated, what the costs are, things like that. A lot of concern about getting them and if they're going to be able to afford them. And this obviously makes it in statute that not only will the cost of testing be covered, but the cost of vaccines whenever they're available, which is, you know, our next point. Your other question about insurance coverage, obviously we can control as far as you know, health insurance plans. Hopefully on the national level, something that will cover everything, all insurance plans will be done soon. I think it's the same argument. I mean, healthcare is a right, and making sure that we get everyone covered across the state and across the nation should be a priority for everyone. So that's definitely my hope, but you know, we're doing what we can, state legislature, to try and cover the people that we can.
And what about deductible?
Once again, I'm not 100% certain if this will count towards your deductible or not, but what I am certain is that you're not going to be asked to be paid. You're not going to be asked to pay for the vaccine. And so you shouldn't be held up that, you know, there's a $200, $300, $500 charge to get a vaccine. I mean, that is definitely what's going to happen. And as far as the aspect of if it will go towards the cost of your deductible or whatever, we'll certainly get that straightened out in committee. But the number one priority is that you get the vaccine without having to write a check or lay out a credit card to get it.
Thank you.
Yeah.
Great. And next we're going to move to Caitlin Andrews with the BDN.
Can you hear me? Awesome. Thank you for putting this together. I have a couple of questions, but that I think are mostly kind of just clarifications. First, I would ask if this bill is meant to address, so the language talks about it extending past the state of the emergency. Is that referring to the Maine state of emergency or the federal state of the emergency? And then there is a paragraph D in the first kind of testing section that maybe addresses this question, but how does this bill affect the uninsured, people who don't have immediate coverage?
It's a good question. I think as it relates to the first part of your question, it's related to the state of emergency declared by the state. I don't believe it's related to the federal state of emergency, but we can definitely get clarification for you, Caitlin, and send that over after the press conference. As it relates to the second part of your question regarding the uninsured, that's a very good question. I'm not sure if we have clarification on that. Senate President Jackson, I don't know if you want to weigh in.
If you're uninsured, the bill will cover uninsured people through federal dollars that we've received or will receive in the future.
Okay, and just one more question. I know that when there were first instances of people trying to be tested, they would find themselves being billed for screenings for the flu or other things before they would go to COVID-19. Is this bill kind of meant to cover all those instances where they may be screened for something else, you know, their doctor's visits that sometimes come along with the actual cost of the test?
I would say absolutely that is the issue, is that even though the governor has put executive orders out about this, there's still confusion, there's still definitely uncertainty across the public, and this will put it in statute and make it very clear that you know, the testing is free. If you want to be tested, if you feel that you need to be tested, there should be no barrier for you going to get testing.
Thank you.
Great, and next we're going to move to Patrick Whittle from the Associated Press.
Thank you very much. I appreciate it. The testing piece seems relatively clear. Could you just sort of speak again to the other aspects of what this bill would do in terms of healthcare access, such as doctor visits, and I believe there was also a piece involving pharmacies.
Yeah, so a couple of other aspects of the bill beyond the testing is making sure that folks who need to receive a prescription, that they can do so with a 180-day supply. That was an aspect of one of the governor's executive orders, but this again puts into law. That way, you know, if we especially at the beginning of the pandemic had folks who were trying to maintain, they were trying to make sure they didn't go out into public very frequently. I had a few constituents. In fact, I made a few runs to the pharmacy on behalf of constituents myself to get them their prescriptions because they were afraid to go to the pharmacist, putting themselves at risk of contracting the virus. And certainly a 180-day supply of their prescription would have helped immensely rather than having to get a refill on a more frequent basis. So that's one aspect. Another key provision in the bill is making sure, as Dr. Ben referred to, allowing telehealth to be conducted through audio. Current law states that it there must be a video component to the telehealth visit, which obviously is a barrier to access for a lot of Mainers across the state, especially those who don't have access or reliable access to a broadband connection. So I think that's a really significant part of this bill, and I think it will have a tremendous impact on making sure more people have access to their provider. Senate President Jackson might have a few more components to highlight as well.
I think Speaker Fecteau, I think you hit those last ones, and as the doctor's already talked about, he's had to have a lot more dealings with people, by other means than in person. And I think it just goes to show, what we've had to deal with in this state. Obviously the virus has, gone after seniors more than anyone. And oftentimes, they don't have the technical skills to do Zoom calls or even the ability. We just had a Zoom call here earlier with Senator Vitelli where her connection was not allowing her to do it visually. She could only call in. Perfect example of a problem right here in central Maine that we're trying to eliminate, making sure that people can just reach out to their doctors with their health concerns and be covered. And so that's, like Speaker Fecteau said, a real critical aspect of this bill that hasn't been covered as of yet.
And Patrick, you also asked about pharmacists, and this bill would allow pharmacists to provide the COVID-19 vaccine.
Oh, that's true. I see. Have you engaged with the insurance lobby at all about this? Because they are fairly well known for not liking to give away things for free.
I'm sure we'll have a really robust conversation when this bill hits committee with those who have interest in this bill. Like all bills in the legislature, we'll have a public hearing and a work session, and we'll be able to have those conversations with those who have an opinion about whether or not this bill should become law.
And so the prescription piece is essentially to allow residents who need them to get larger supplies of prescriptions to reduce the number of visits they have to make to a pharmacy. Is that
Exactly.
generally the idea? Okay, got it. Great.
And Patrick, to your point, haven't as of yet talked to the insurance industry, but AARP, Consumers for Affordable Health Care, are all in strong support of this legislation.
Good to know.
Great, and I think our last question is Brad Rogers from WGME. Brad, are you there?
How about now? Can you hear me okay now?
Yes.
Yes.
Okay, great. Sorry about that. Couple of questions. Will this bill pass change any of the priorities in getting the COVID vaccine? And also, I think I heard Senator Fecteau say that all healthcare facilities under this bill would be required to treat COVID patients. I know a lot of healthcare facilities are sort of splitting up their facilities where one facility might take COVID patients and one would be for patients with non-COVID symptoms. Your thoughts about that?
Well, the first part of your question, no, I mean, you know, the unfortunate thing is we don't have enough vaccines at this point. And so the CDC is, along with the governor's office and other people that, you know, have obviously put forward suggestions. They're trying to come up with the best way to get what limited supply we have out there, you know, to people that, you know, need it. You know, being seniors, healthcare workers, stuff like that. You know, unfortunately, we don't have enough at this point, even though the state of Maine, I think, is one of the top 5 states as far as getting our vaccines out. So this does not change at all who's going to get it. I mean, what we know and what we want is everyone to get it. And that's what this bill does, is make sure it takes away the barrier of cost so that when we do get more prescriptions, more vaccines, you know, people will get them as soon as possible. And for the second part, if it's okay, I'll hand that to Speaker Fecteau. I think he referenced you. I don't think that was the case, but I'm gonna let Speaker Fecteau answer that.
Yeah, I don't think I said what you're asking. So, no, I don't think the bill will have any impact on whether or not a provider is seeing is the management of their office and how they're ensuring that some patients are seen at in one aspect if they're potentially COVID-19 positive, and in one aspect if they're not.
Just when he said that.
Well, just to finish, I definitely want to thank the doctor for his work throughout this. I mean, obviously leaving your family must have been a very big burden on all of you, your wife included, and obviously your work across the state with you know, people that needed your assistance. I really can't tell you how much I appreciate that. And thank you for being here with us today to add that to the conversation.
Thank you for having me.
I think you can just hang out now. Fuck it. Well, we got.
And with that, I think we're going to wrap this up. So I don't know if President Jackson, Speaker Fecteau, want to say anything in closing before we all sign off.
Nope. Thank you for the questions, and look forward to the upcoming session.
Yeah, thank you all for joining us today. Like I said, you know, healthcare obviously is a huge priority for us, and this obviously falls into line with it. You know, making sure that people have access and can afford it. On this case, they won't even have a cost, but you know, it's really important to make sure that as many people as possible get the vaccine, and not having a barrier of cost is a big deal. And so thank you for being with us today, and look forward to you know, making this legislation come into effect.
Thanks, everyone.